Gage Kumar here, crushbackpain.com. Today we're going to talk about exercises for lower back pain. There's two primary ways to determine the best exercises for you in your specific lower back pain. We've talked about directional preference in a video here. You can check that out. That video shows you how to determine if you have a directional preference and what it might be. That's the first way to determine exercise prescription when you have lower back pain. So if you have a directional preference, you're going to want to do things that facilitate spine motion in that direction that your spine prefers and that reduces pain. Again, check out that video where we covered directional preference. The other way to determine exercises for lower back pain is to do some specific tests and figure out what specific impairments you have that need to be addressed. We know for a fact people with lower back pain have muscle performance impairments of the multifidi muscles, the lumbar extensors, the lateral lumbar musculature, the obliques, and also the abdominals, the rectus abdominis, the anterior trunk muscles. We can test those muscles specifically. We can test each group of muscles. We can figure out exactly what your numbers are, compare those to normal numbers, and know right away if those muscle groups are impaired with you. Then if they are, we can work those directly. So instead of just guessing on what exercises to do and hoping they work, you can figure out exactly what impairments you have and then address them accordingly. This is really important, and it's really powerful because you're not just throwing everything up against the wall and hoping something sticks. You're determining exactly what muscles have issues and what muscles need to be addressed and then doing it. So you're not wasting any time, you're not doing any exercises that are not going to benefit you. You're doing exercises for lower back pain that are specific to your lower back pain. This helps the lower back heal, it helps symptoms decrease faster, and it just works better, obviously, because you're addressing what needs to be addressed, not doing things that you don't need to do. So what we're going to cover today are 3 simple tests that you can do without any special equipment. I'm going to show you exactly how to do those tests, and then I'm going to talk about the normal numbers for those tests so you can compare your numbers to normal and know if you have impairments. We know in people with lower back pain, you know they have impairments with these tests. So you may have impairments with all of them, you may have impairments with some of them. Whatever the case may be, you're going to determine what muscle performance impairments you have. And then in the next video, I'll show you how to address those impairments depending on what you found. Something to keep in mind with the tests we do, they're not gross strength tests, they're more endurance tests. So we always talk about strength with the lumbar spine and the core because it's easy to conceptualize and people just understand it. A better way to describe what we need to improve with trunk musculature when somebody has lower back pain would be endurance. The trunk muscles lack endurance and they lack neuromuscular control. So the tests actually test endurance and control. And then the way that we train those muscles, especially initially, they're more for endurance, neuromuscular control. And then as we dial that in, we can transition more to strength and power. But initially, we need to work endurance, and that's what's most impaired in people with lower back pain. So let's take a look at these 3 tests that look at the lumbar extensors, the multifidi, basically the back muscles on either side of their spine. We're going to look at the lateral abdominals, the obliques, and the front abdominals. So we're going to do 3 different tests. We're going to determine what your numbers are. We're going to talk about what normal is so you know if these numbers are impaired or not. And then in the next video, as mentioned, I'm going to show you exactly how to address the impairments that you found. If you have any questions, drop me a line below. If this video helps you, give me a thumbs up. And check back every week here at the Crush Back Pain YouTube channel for proven methods to beat back pain permanently. The first test we're going to look at is the trunk extensor endurance test. This test looks at the muscles on either side of the spine. So on either side of your lower back, all the way up through the thoracic spine, those are the trunk extensors. So with this test, we're going to test the endurance of those muscles. It's well documented in the medical literature that people with a history of lower back pain have decreased endurance times. So we're going to test that and see if you have decreased endurance times, and if you do, show you exactly what type of exercises to focus on. So with the trunk extensor endurance test, you're going to need some sort of table. I'm going to use this treatment table here, and ideally you're going to need an assistant to hold down your feet. I'm going to show you without an assistant because I don't have to have one here right now. But when you try this out, you need to have somebody holding down your legs so you can do the test effectively. The other thing you want to keep in mind is these little bumps on the front of your pelvis. That's the ASIS, the anterior superior iliac spine. You want those little bumps to be off the edge of whatever surface you're using. So the way that you do this test is you position yourself so that part of your pelvis is off of whatever surface you're using, and then somebody will be holding down your legs so you can effectively complete the test. I'm just going to hook my feet back here, and then what you do is you put your arms across your chest and you literally just hold, just like this, and you hold as long as you can. Now when you start to drop down like this, you terminate the test. It's that simple. So you're effectively testing how long your spinal extensors, the muscles on either side of your spine, can hold your spine up in a horizontal position. So you're horizontal with the floor, and you terminate the test when your trunk starts to go down towards the floor. You time it in seconds. Now, with this test for a male, a healthy male, you should be able to hold it for around 146 seconds. For a healthy female, they found that the normal hold time was around 189 seconds. And that's not a mistake. Females were found to have better extensor endurance compared to males. Now, these numbers are probably not where you're going to be because you have a history of lower back pain, but they give you an idea of where you should be, and they give you a goal to work towards. So try that test out, see if you have decreased static extensor endurance, and if you do, then you need to address that muscle imbalance, that muscle impairment with specific exercises. Again, the keys to the test, the surface that you're using, you need basically your pelvis to be off the edge. You don't want your pelvis to be held up by the table or those muscles won't be fully active. So you don't want to be way back here with this on your stomach. It makes it a lot easier. You need to be off the edge where that bump in the front of your pelvis is actually off the edge. So you have to use the trunk extensors to hold yourself up. You need an assistant. You're here, you're holding it. You terminate the test when you start to go down towards the floor. That's the static trunk endurance test. Give that a try. The next test we're going to discuss is the side bridge endurance test. This test looks at the quadratus lumborum musculature and the internal and external oblique musculature. So the quadratus lumborum attaches from the pelvis up to the lumbar spine and the lower ribs, and then the oblique musculature attaches from the pelvis to the thoracolumbar fascia, which is just a big swath of connective tissue back here that has a lot of different muscle attachments. So the side bridge endurance test looks at those muscles specifically. With this test, it's super simple. You're just going to lie down on your side. You want to put your top leg over the bottom leg. Your elbow is going to be stacked right underneath your shoulder. You take your top arm, put it across your chest, hold on to that lower shoulder that you're resting on, and you're just going to bridge up, okay? And then you're going to hold that position as long as you can. You terminate the test when you start to sag down like this, or you have to try to twist or compensate. So you want to just hold that in a straight line for as long as you can, and you time yourself in seconds. It's that simple. For normal times, a male should be in the mid-90s, somewhere in the mid-90s, timed in seconds, and a female should be in the mid-70s, timed in seconds. Now, the other thing you want to look at is side-to-side differences. You do this on the right and the left side. I just showed you on my right side. You would also do the test on the left side. And then if there's a 5% or greater difference between the left and right sides, that's considered an impairment also. So you would just divide the left time by the right time, and vice versa. See if there's a 0.05 or greater difference between sides. If there is, that needs to be addressed. Also, you're probably not going to be in the 90s if you're male, probably not in the 70s if you're a female, because you have a history of lower back pain. Again, these are normative data, so it's numbers of people that don't have lower back pain. This gives you a goal to work towards and an idea of what your endurance times should be. If you do have issues with this test, if you found that there's an imbalance between the left and right side, or you're not where you need to be, the next video is going to show you exactly how to address muscle imbalances with this test. Next, we're going to look at the trunk flexor endurance test. This test looks at primarily the rectus abdominis, so the muscles that attach from your pubis up to your ribs. So basically the abs that everybody thinks about. If you can see your abs, that's the rectus abdominis. So you're testing those anterior abdominal muscles. So this test, in the literature, I've seen it described several ways. Sometimes they say they use a 50-degree wedge, sometimes a 60-degree wedge. Sometimes they say they have an assistant holding the feet down. Sometimes they put the feet under a strap. The way that you're going to do it, because you don't want to have to go out and buy a wedge that's a certain degree, is you're going to have an assistant. You can do this on the floor. Your hips and knees are going to be at about 90 degrees. So like this, you're going to have somebody hold down your feet. You're going to put your arms across your chest, and you're literally just going to come back until you feel like it's hard to hold, about right there, like you have to work to hold it, and then you're just going to hold that position. You're going to hold that position as long as you can, and then when you start to come back, because you can't hold it anymore, the test is terminated. The important thing is that you have somebody holding your feet down, you've got your arms across your chest, and you're not just sitting here. You can sit here forever, and you're not way down here where you can't really hold, and you have to round out your back. You just ease back to about here, where it starts to get hard to hold, and then you hold it. Just like this. And you record that time in seconds. Now, normal times for a male, again a healthy male without a history of lower back pain, is around 144 seconds. The time for a female, normal time, is around 149 seconds. You're probably not going to be in that range because you have a history of lower back pain, but again, it gives you a sense of what is normal, and it gives you a goal to work towards. Now, if that test is impaired on you, if you're below those thresholds, then it's going to be something that you want to work on and you want to address, and I will show you how in the next video. Another thing to keep in mind with the static trunk flexor test and the static trunk extensor test is the ratio. So ideally, your extensors should be your extensor hold time, that test where you had your body off the side of the edge of a table or a treatment table or whatever it is you use. That test, the hold time should be longer than the test that we just went over for the flexors. So if your flexor hold time, if this hold time is longer than that hold time where you're off the edge of the table trying to hold yourself up like this, then that's considered a muscle imbalance too, and that's found in people that have a history of lower back pain. So if you have a longer flexor hold time than extensor hold time, then that's something that you're going to want to address also. Check back with the next video series so you can figure out exactly how to address these common muscle performance impairments that go along with lower back pain.